Hi, my name is Kathy Sarmiento, and today I wanted to talk about Medicare enrollment. Medicare is the federal health insurance program, and there are a few different enrollment periods. One is your initial enrollment period, that is the 7-month window surrounding your 65th birthday month. So it's 3 months before your 65th birthday month, your 65th birthday month, and it goes all the way through 3 months after your 65th birthday month. Another enrollment period is the open enrollment period. This happens every year between October 15th and December 7th. That is the time of year when people who already have Medicare can change their Medicare for the coming year. So it's really important to do an insurance review between October 15th and December 7th. The next enrollment period is the general enrollment period, and that's for people who have missed their open enrollment or their initial enrollment. The general enrollment is for people who missed their initial enrollment, so now they want to enroll, and they can do that between January 1st and March 31st each year. If they do that, then they're probably going to get a penalty for late enrollment, which will last the rest of their life. But let's say you enroll in January, your Medicare would start in February. If you enroll in February, your Medicare would begin in March. And if you enroll in March, your Medicare would begin in April. The next enrollment period is a special enrollment period. So if somebody has health insurance through their employer or their spouse's employer or a union or a retiree program, and you want to keep that health insurance even though you're turning 65, you can do it if the health insurance is creditable coverage. And that means that the health insurance is as good as or better than Medicare. So if you have health insurance and you think you might want to keep it, ask your insurance company, are you creditable coverage? And if they are, you can keep it and enroll in Medicare later on in your life when you're older with no penalty, just as long as that insurance is creditable. If you're working for an employer with 20 or fewer employees, they do not get a special enrollment period, or you don't get a special enrollment period. You have to enroll in your initial enrollment period when you turn 65 to avoid a late enrollment penalty. And the last enrollment period is a Medicare Advantage open enrollment period. This is fairly new in the US. It's between January 1st and March 31st. And this is for people who have a Medicare Advantage plan, which are HMOs, PPOs, special needs plans. And it allows you to change from one Medicare Advantage plan to another. So we'll talk about why, but my goal here with these videos is to educate people about Medicare, and I'm going to do live streaming so that if people have questions, they can ask. My qualifications are that I work at the Area Agency on Aging in Miami, Florida, and I manage the SHINE Medicare Counseling Program. That is a grant from the federal government to provide free and unbiased information about Medicare. It's called SHIP in other states, and it's not included in our budget coming up. So I don't know. I'm pretty sure the program's going to go away, and I think people still need the information. So that's why I'm doing this. So I look forward to speaking with you.